Hello again, everyone, and welcome back to Reddit Aliens. I am John, and as always, thank you so much for being here. We've got an interesting topic today, full of insight. Let's do it. Doctors of Reddit, what's the craziest thing you've ever seen inside of a patient? Please remember to like, share, and subscribe. Not a doctor, but a former Navy corpsman. I had a patient come in a few weeks after shooting himself in the femur with a nail from a nail gun. He was on the roof and started to lose his balance and apparently instinctively placed the nail gun on his leg to keep himself upright. He fell off the roof, pulled out the nail with a pair of vice grips, but couldn't get all of it. He thought it wasn't a big deal until one day he was casually walking and his femur snapped in two. As an intern, I saw a patient with a horrible open abdominal wound that wouldn't heal and horrible hygiene with no self-care. He came into the ED due to abdominal pain, and we found him about 12 maggots buried into and crawling into his large open wound. I have a frequent flyer who enjoys systematically inserting needles and straightened out paper clips up his urethra and then coming to the hospital to get them removed. A few years ago, when I first started working in the ER, a patient came in with severe rectal pain and bleeding. Upon inspection, he had large and visible hemorrhoids, so the reasonable assumption was that he had an internal one that burst and was the source of the pain and discomfort, right? Well, turns out the patient had been experimenting with a gaping device and was placing wine glasses inside his anal cavity. The device was cheap and plastic, which, when he was startled by his mother walking into the room, caused him to flinch and flex his sphincter closed and broke the device and the wine glass inside. They managed to get the device out of him, but had to come into the ER to have the shards removed. X-ray tech here. We had one where a patient stuffed a bottle of maple syrup up his butt, and you could tell the brand was Aunt Jemima from the X-ray. Had a 12-year-old patient come into the ICU with a bullet wound on the frontal part of her head. Pink brain material was oozing out of the bullet hole and out of the nose. For reference, I was doing medical practice in a relatively small hospital in Guatemala. Pretty dangerous city before drug trafficking and all. From the little story bits we could gather, the kid was just playing alongside a nearby river when he suddenly collapsed on the rocks nearby. His grandfather was nearby and was the one who brought him into the hospital. The story suggests that a stray bullet was the one that hit him. The grandfather's story suggests that he heard shooting on the other side of the river but didn't pay much attention to it because it's common for people to carry guns around and sometimes just randomly shoot in the air. Unfortunately enough for the child, the bullet hit him straight in the head. We had imaging done on the child, and once we got to the head, we saw that his brain was practically turned into mush with the bullet still inside. We tried everything we could, but he ended up passing away a few hours after. Well, when I was posted in the forensics department during my medical school, I once got the opportunity to see a slug lodged in the trachea of a dead man. Yep, that's how he had died. He choked on a slug while trying to eat it whole and raw. Oh, and he also had 2 chilies in his pocket, which the residents assumed he was going to eat while eating the slug to make it more spicy. My uncle is a doctor. He told me about a time he found a fork and knife inside a patient. How it got there, or through which orifice it came in through, I was never told, nor do I want to think about it, but I know that he doesn't like to tell the story. Late to this thread, so we'll probably get buried. Disclaimer, I'm a doctor, but this happened years ago in medical school with one of the cadavers we study anatomy on. Not a live patient, but I still thought it was pretty crazy and definitely memorable. In the preclinical years of medical school, most of the medical schools have students enroll in an anatomy lab where we dissect cadavers as part of the course. One of the anatomy labs had a cadaver who had passed away from complications from kidney failure, according to the ID tab. While the anatomy team was dissecting some of the leg and buttock muscles, they found a small caliber bullet in the glute medius. No idea how it got there and totally unrelated to the cause of death. I like to imagine this guy signing paperwork to donate his body to science, thinking that the med student dissecting his butt would get a funny surprise, lol. It wasn't a doctor, but I got my flared butt plug stuck in my asshole and was so embarrassed I called my best friend over to help me get it out. She's big into anal stuff with her hubby, so I knew if anyone was able to help me, it would be her. My husband got home a few hours later and said, "While you were at work, Bestie had to come pull my butt plug out of my asshole." He was grateful because at the time, his brother-in-law was the ER doctor here, lol. I mean, that's a pretty good friend right there. Oof. Alright, so if you had a similar situation, who would you call? Not a doctor, but I worked at a hospital as a phlebotomist. One night, a man came in with a toy plastic broccoli up his butt, like from a kid's play kitchen. He was the talk of the hospital for a couple of days. EMT here. I've had a homeless guy who complained about numbness and an inability to move his legs. Upon further inspection, there was more parasite and bacterial infection than leg. Literally had to use a trash bag to prevent the maggots from getting everywhere. Xylazine is a hell of a drug. There was an SNL skit where Louis C.K. that was pretty funny in 2014 where he's at a doctor's appointment and is overly concerned that there might be a Darth Vader action figure in his ass. Sure enough, not myself, but a colleague had to remove a Darth Vader from someone's rectum around the same time. They'd seen the episode and wanted to test it out. The limbs made it hard to remove. My mom was an ER nurse, and someone had shoved an entire wine bottle up their ass. The bottle created a giant suction, and it had started to pull their intestines out when they attempted to remove it. They had to drill a hole in the base of the bottle to kill the suction, and then remove the bottle from their asshole. It was a Pinot Noir, at least. When I was cycling, I had a freak event where a bee flew into my mouth and stung my uvula. Rode 8 miles back home with what felt like an awful sore throat. Checked in the mirror, and stinger was still lodged in. Went to urgent care, after where a doctor had to numb and remove it with tweezers. After successfully removing it, he said he has never heard of it happening before, and we had a laugh about it. Overall, 4 out of 10. Enjoyable for sure, but not the worst thing I've experienced. Was riding with 2 people who were very allergic to bees, so would have been likely deadly for them. Not a doctor, but I have to look at x-rays in my role in patient treatment. Dude had a bit of a run-in with a tree stump grinder. There was a straight-up small branch embedded in his calf. That said, most of the calf was hanging off his lower limb, and he had to go in for surgical debridement of the leg almost daily, because trees are not very sterile and have a lot of splinters. Just a medical student, but during one of my rotations in the ICU, we had this patient who had not 1 but 2 strokes within a 24-hour time period. When he first came to the ED, it was clear he was having a stroke, but his symptoms were relatively mild. Some numbness in his fingers, mild difficulty speaking. He didn't think anything was wrong, so he left against medical advice before we could do any serious workup. He came back later in the day with much more severe symptoms, and so he immediately got spirited up to the ICU, which is where I saw him. On his MRI, it showed signs of watershed strokes, which are a special kind of brain injury, which indicate the brain as a whole is not getting enough blood. We typically see this type of stroke in severe trauma patients who have lost large amounts of blood, but this guy didn't have any signs of blood loss at all. We did some more advanced imaging, and what we saw was that he was missing both his carotid arteries and one of his basilar arteries. Normal people have 2 of these that run up from the spinal cord into the brain. So basically, he only had 1 tiny blood vessel perfusing his entire brain. The end result of this was that whatever his blood pressure dropped the slightest amount, his brain would get starved for oxygen and he would have a stroke. The real kicker? Even after being admitted to the ICU and being on multiple pressors to keep this blood pressure up to prevent him from stroking out, he still wanted to leave against medical advice. Back when I was a medical student on OBGYN rotation, we had a 90-plus-year-old woman come in for brown discharge. It was the last patient of the last day of the rotation. My attending took a look and turned out she had a pessary from a who knows how long it's been in there that eroded through, made a rectovaginal fistula. She told me to go home that day. The other would be in Peds ER when I was a senior resident seeing a suicidal teenager. She was cleared and safe to go, but told me she was having leg pain. I asked about it more, and she said she would put the needles in her leg. After palpitating, sure enough, it was consistent with a sewing needle. We did x-rays, and she had 4 embedded in her leg. We referred to surgery and discharged as there was nothing emergent to do. While working in the ER, I had a patient come in with a screwdriver for eyeglasses stuck in his urethra. He claims to have picked up a girl at a bar, brought her back to his place, and he must have blacked out from the alcohol during the activities. Apparently, she didn't like that, so she grabbed the screwdriver off the nightstand, shoved it in there, and left. He woke up the next morning and it had gotten sucked all the way into his perineum. You couldn't even see it anymore, but you could feel its outline during the physical exam. Took care of a patient in the ICU who went in for a routine urologic procedure, ended up having complications leading to abdominal perforation. He ended up with an incision from below his sternum all the way down to his pubic bone. Since he had active infection draining pus from the abdomen, they left the wound open and packed it with cotton to wick out the infection. Needless to say, that guy was absolutely effed, but he eventually recovered and walked out of the hospital. Not a doctor, but EMT. We transported a patient from a psych ward with pica one time. He had a fist-sized lump on his stomach. The patient claims they are nickels that he ate. The jingle from the physical exam and hitting bumps in the ambulance confirmed they were coins. The patient ate so many nickels that they were visible on the outside of his body as a lump on his abdomen. How he got like $20 in nickels in the psych ward is a mystery, however. A few things come to mind from my general surgery days. This one patient lost a telephone pole insulator in his rectum. We had to open his abdomen and make a cut in his rectum to remove it, without a base, without a trace. The second one is a guy that had a colostomy and eventual reversal from having this sort of thing happen in the past. He shoved a hanger up his urethra as a sounding rod and perforated his urethra. The third was some unsuspecting guy that said he was at a rodeo and a bull's horn hit me in the rectum. Veterinarian. My first year out, I had a young Yorkie whose elderly owner brought him in because he was straining to defecate. I was performing a rectal exam and felt something hard and linear, and I managed to get my finger under it and lift or ease it out. It was a sewing needle. The owner was shocked. We were all curbside at the time, COVID, but she kept exclaiming over the phone, "A needle? Oh my God," until I finally broke in, "Ma'am, I'm just as surprised as you are." Fortunately, when we did radiographs, there were no other surprises and the dog did just fine. I'm just very glad I didn't stab myself with that needle.